Dr. Now we'll go and hear from our friend Simon Ateba, who will introduce himself. Simon, please go ahead.
Thank you for taking my question. This is Simon Ateba with Today News Africa in Washington, D.C. The Biden administration announced last week that it was sending the first batch of 5 million doses of COVID-19 vaccine to African nations under the WHO initiative COVAX to be shared by the African Union/Africa CDC. I would like to get an update from you. How many doses have been received so far? How far can 5 million doses go or last? And has the WHO given some guidelines to the Africa CDC on how to share those vaccines evenly and equitably across the continent? Thank you.
Thank you very much, Simon. Dr. Aylward.
Hi, Simon. Thank you very much for the question. And it's an opportunity just to recognize and thank the United States people and government for its commitment to share doses and for kicking off the dose sharing at such substantial numbers. I think, as most of you will have seen, last week President Biden announced that they would be contributing 80 million doses to the vaccination of people in other countries in the month of June, with 75% of that going through COVAX, and the plan for the initial 25 million was released last week at the same time, and we're grateful for that. That's a great start and great leadership in highlighting the importance of sharing doses and doing that rapidly. And as you highlighted, Simon, a proportion of those doses will go to the African continent. So we're still working out with the U.S. government for the release of the vaccines through COVAX, and that work is ongoing to move them as quickly and expeditiously as possible. In terms of how far 5 million doses will go, it can go very far when it comes to protecting especially healthcare workers and highest risk populations. And also it's very, very important to help countries initiate vaccination in some places and start the scale up of vaccination. So every dose counts, every dose is helpful. And clearly in settings where the number of doses shared so far, and in the African Union, if I remember correctly, the number of doses that have gone there through COVAX is about 25 million. So this would be about another 20% on top of that, and that would be an important contribution, although still, like you highlight, many more needed. In terms of the guidance given, we work closely with Africa CDC, and in general, we are all working to that same guidance, of course, that number one, we're trying to prioritize healthcare workers, trying to prioritize older populations, and as we look at donations, we try and look at what does coverage look like across countries already, what is the absorptive capacity of the different countries in terms of how they're able to absorb and use doses, and also what's the situation they're facing in terms of that risk. So with the donations, we look at our allocation criteria, our standard allocation criteria, and then we have a little bit of flexibility to also look at how to put them to best possible use. And so that's the general guidance that we use, Simon, across all countries, and that we continue to work with, irrespective of whether it's within Africa or other parts of the world.
Thank you very much, Dr. Aylward. We will conclude this press briefing.